You're watching Let's Chat.
We're glad to have you back with us as we continue on Let's Chat. It is Tuesday. We are here to spend a few minutes now with our friend Dr. Tom Devlin from CHI Memorial. Dr. Devlin, good morning. Good to see you.
Good morning, Chip. Great to see you. Thanks for having me.
You guys are doing tremendous things as it pertains to stroke research and treatment at CHI Memorial. Before we launch into the heart of what we're here to talk about, can you give us a little bit of a sneak preview about some of the good news that we are going to hear, hopefully coming from you and CHI Memorial over the coming months?
Well, I appreciate you asking me that. I think the bottom line is, Chattanooga community here has really pulled together over the last 20 years, and we've been a major force in forging new treatments for stroke. I mean, we've really been integral to all the development of the new technologies. Clot grabbing devices, stem cells, artificial intelligence. And I'm just here to tell you that that is going to continue in a very major way. And actually, you're going to see a real growth spurt in that. So, this is a high-tech city. This is a city with a tremendous heart and commitment to the health of our community. And what we're doing over at CHI Memorial is really going to continue that. And I think you're going to hear a lot of exciting things that we're going to have an even bigger presence on a national and international level. So
they are certainly lucky to have you leading the pack when it comes to this. Obviously, Dr. Devlin, a world-renowned stroke specialist. So we're going to move ahead. You have been spending a lot of time in COVID wards, I understand, and you've also been making real progress on exactly what happens as far as COVID patients are concerned, neurological side effects after the COVID virus has passed. Fill us in on that.
Yeah, I think this is a very important topic that everybody needs to know about. Hamilton County, just like everybody else, has been severely affected with COVID. We have about 41,000 cases of COVID that we've had over this last year here in Hamilton. So we've learned a tremendous amount about how to treat this. Our mortality rates are going down. Our numbers actually are going down, which is great. But we're still learning a lot, particularly, Chip, we're learning about how people recover from COVID. One of the things that we know, and the key thing to remember, is the vast majority of people that get COVID recover just fine from this.
Right.
And however, at some point in time, during the course of the illness, about 80% of people actually have some neurologic symptoms as part of their COVID illness. We also know that in some cases, as people recover, some people get what are called long haul symptoms, where they have symptoms that last a long time. And while these symptoms are largely related to malaise and fatigue, in about a third of those cases, they actually have persistent neurologic symptoms. And this is important because these symptoms can be very alarming to people. And the
symptoms
key thing
like
to remember—
can you give us a few examples of the symptoms?
Absolutely. And there's clinics popping up all over the United States now at Mount Sinai up in New York, particularly at Northwestern. There's a clinic at Northwestern in Chicago that just focuses on the neurologic symptoms. And the key thing is that from these clinics that have popped up that are doing research, we've learned that in some of these long haul patients that have persistent symptoms, the number one symptom in 45% of people is muscle aches, is myalgias. In about 37% of patients, they have persistent headaches. There's a phenomenon called brain fog, which happens in about 30% of long haul COVID patients as they recover, where they're just not thinking clearly. About a third of these patients have dizziness, imbalance. They just don't feel right on their feet. And we know that both persistent change in smell, or loss of smell, and loss of taste are quite common as well in about 15% of patients. Now, the good news here, Chip, is the research has suggested that this is not due to the virus invading the brain.
Right.
It's really a part of the systemic inflammatory response, where the body has an inflammatory response, an immune response to the virus. And as part of that immune response, with the production of different proteins and what are called cytokines, that these actually can irritate the brain and irritate the nerves, but it's not viral infection in the brain in the vast majority of these symptoms.
How do you treat these symptoms?
So I think the key thing to remember is there are some serious neurologic side effects of COVID, which can occur, and we've been seeing those. They're in less than 1% of the population. Do we see stroke? Do we see seizures? Do we see actual brain infection? And we're certainly in a good position to treat those patients as well. But the key thing to remember is that with these symptoms that people have, it's largely symptomatic treatment. There is no primary treatment. There's no medicine. There is no vitamin that actually removes these symptoms. But what people need to know, that I want the audience to know, is first of all, there's a lot of people in COVID in our community. The vast majority of people have done very well with this, number one. Number two, persistent neurologic symptoms are common, and those symptoms may last weeks to months, but they are going to go away and you're going to be fine. Now, the key things to remember are there are some times when we want to take a look at the patient. So specifically, if you have severe memory problems with this, and we want to make sure there's no strokes, we want to make sure there's no bleeding in the brain, because COVID does create the situation which increases the risk of bleeding and the risk particularly of stroke. So if you have significant memory problems, if you have significant persistent headache, particularly if it's associated with weakness or numbness on one side of the body, if you have visual changes, these are the things that suggest that there may be something more serious going on.
Dr. Devlin, we're going to have to
that's
leave it
when
there.
you want to. That's when you want to reach out to your primary care doctor.
We're going to have to leave it there, and the work you're doing in regards to this and stroke research, it is just astronomical. We're lucky to have you in our community. You and I will talk soon. If you want to find out more about Dr. Devlin and the great work going on at CHI Memorial, they're only a mouse click away. Stick around. We will be right back.